All right, welcome back. You're about to meet a doctor who last year was named top orthopedic joint surgeon, according to Find a Top Doc. His name is Dr. Ryan Charette, and he is the nicest guy, also very, very good at what he does.
Yeah, well, he is with Comprehensive Orthopaedics right out of Wallingford, specializing in hip and knee replacement.
Yeah, I had a chance to sit down with him last week, and I learned so much. Take a look.
This is video of a 42-year-old woman walking. Not a big deal, right? Until you learn she just had hip replacement surgery 10 days earlier by Dr. Ryan Charette of Comprehensive Orthopaedics in Wallingford.
I had to take a video, so this is her just 10 days out, no pain, so she hadn't felt this good in years.
10 days out, a 42-year-old female, and look at this, that is amazing.
Yeah, so I mean, of course, some patients recover more slowly than this. She was young and active and healthy, but a lot of patients can get this result quite quickly.
Dr. Charette is an orthopedic surgeon specializing in hip and knee replacement with Comprehensive Orthopaedics in Wallingford. They have other branches too.
Main hub is here in Wallingford, but we go to Meriden. We have an office right at Mid-State Medical Center. We have an office in Southington and another office that we opened about a year or so ago in Cheshire.
The good doc says people like to come here because it's like a family.
I think we're one of the smaller companies in the area, so I think it has more of a family type feel. I think some of these big corporations, people can get very lost in sort of the system. So I think there's that. I think when they come in here, they see all the coworkers get along really well together. You know, we're friends outside the office, so it's not just a work relationship. So I think people sense that like family type atmosphere. And we also, you know, with specialists, we cover the entire body. We have hip and knee for myself, we have sports medicine, we have foot and ankle, we have spine, we have hand and upper extremity. So any problem anybody has, they can see someone who's done, you know, additional training after residency in that specific area of the body.
As we mentioned, Dr. Charette is a hip and knee specialist, and he loves explaining to his patients exactly what's going to happen. Take a look at these models he uses to show everything off.
So I get this question in the office all the time, like, what do you actually do during the surgery? So on the knee replacement side, I think replacement's actually kind of a bad word. I like knee resurfacing a little bit better. So basically what we do is we just shave off the ends of the bone, and then we put these metal caps on. So this is kind of a metal cap, this is a metal cap with a piece of plastic in between. And so you no longer have that bone-on-bone rubbing that's causing all the pain. It's metal and plastic now. Wow. So that's sort of what your typical knee replacement looks like. We can also do partial knee replacements in any part of the joint. If somebody has just disease on one side of the knee, we can just do this partial knee replacement on the inside here. I do a lot of these. If somebody just has arthritis underneath the kneecap, then we can do this kneecap only replacement. We can also do this partial knee replacement on just the outside too. So we can really kind of tailor, you know, not everybody needs a full knee replacement. We can kind of tailor their replacement to what they need.
That's excellent. And this is the hip?
Yeah, and then on the hip side, so in a normal hip, you know, this is all bone here. This is the ball part of the hip. And so what we do is we actually do cut this old ball part of the hip out because you no longer need it and it's arthritic. And then on the cup side, there's a metal cup that we put in with a piece of plastic. And then this sort of metal implant goes into your thigh bone and houses the new ball, and that's kind of your new hip replacement.
And listen to this.
Hip replacement is a fantastic operation. I think it's probably the best operation in all of orthopedics in terms of pain relief and return to function and complication rates and all those sorts of things. And you know, historically there's been lots of different ways to do it, and it's a fantastic operation any way you do it. And there's lots of different ways to access the hip.
One of the ways is the anterior approach.
You can go in from the back of the hip or the side or the front, and you know, I've chosen, and I think it's coming into vogue and becoming more popular for people to go in through the front of the hip or anterior. Couple different reasons I think it's better. It's truly like a muscle sparing operation, whereas when you go in through the back of the hip, you kind of have to detach some muscles, and then at the end you have to reattach them with suture. This way we're able to just kind of spread in between the muscles and get to the hip that way. So don't have to cut any muscles. Patients lying on their back during the surgery as opposed to on their side.
For the knees, the doctor takes a robotic approach.
I think that's been the major advancement in knee replacement over the last couple decades is robotics, and I think people get a little bit confused about what robotics is. Like they think it's like one of the Terminator robots standing next to us in the OR, but it's really more computer navigation, and there's a lot of different systems out there. The one I used is based on a CAT scan, so we know exactly kind of what the architecture of their limb is, what their bone looks like, and then we use that with some preoperative planning, with some intraoperative decision making, and we can really very precisely dial in where to put the implants so that it's perfect for that patient. We can adjust it by ½ degrees, ½ millimeters, very, very precise. Whereas the old days, or the old-fashioned way, was to kind of put these jigs on and kind of eyeball it, and now we have real concrete data, real numbers, like real things we can look at during the surgery.
If you're having trouble with your knees or hip, think about Comprehensive Orthopaedics in Wallingford.
There was a study that came out a number of years ago looking at surgeries across all of medicine and what were the best surgeries in terms of, again, return to work, return to function, pain relief, things like that. And hip replacement was #1, cataract surgery was #2, and knee replacement was #3. So
you got two of the top
so
three.
I did 2 of the top 3.
That's pretty good.
I see people who can barely walk, walker, cane, and they come in with no pain. It's fantastic.
Really is. Dr. Charette is such a nice guy, and he trained right here in Connecticut. If you would like more information, please head to their website. It is comprehensiveorthopaedics.com, and tell them Great Day Connecticut sent you.
Awesome. All right, still ahead, we have some fun for you on your Tuesday afternoon, getting you in the holiday spirit, because Santa Claus is coming to town, and he's got plenty of holiday helpers joining him that I got to meet.
Yeah, we're going to sit down with some great local members from the New England Santa